Hi there, everyone. Dr. Andrea Shanowski from Freedom Chiropractic and Holistic Health here in Peoria, Illinois. Now, you know it's Wellness Wednesday, and that means that we have a new video every Wednesday at 5 o'clock. We go live at 5 on Wellness Wednesday. So this week, we're going to talk a little bit more about how stress affects your hormones. Now, I get a lot of questions from my patients, as well as patients that are calling in and curious about what we do in our office. As to number one, what is going on in my body? Why am I dealing with issues with stress making me feel like I'm falling apart? Why am I always tired? Why am I fatigued? Why do I have these symptoms of feeling, like extreme tiredness in the middle of the day? Why am I falling asleep earlier? What is going on in my body? I haven't changed anything. Nothing in my life is changed. What's going on? So what I want to do tonight is we're going to talk a little bit more about how stress affects your hormones. Now, I'm going to talk about three very important hormones that tend to cause most of our body's issues, and they can lead to not only hormone imbalance for your whole entire body, they can actually lead to blood sugar imbalances, and they can also lead to a neurotransmitter imbalance that can affect your brain function, your digestive system, as well as your mood. So really important day today. We're going to talk a little bit more about how those hormones affect your health. And then next week at Next Wellness Wednesday, we'll be talking about more about number one, how you can actually find out if you have a problem and know specifically how to treat it. So we'll talk a little bit more about testing options. We'll talk a little bit more about supplements and dietary changes and lifestyle changes that you can make to actually get improvements in your body so that you can balance your hormones and feel more like yourself. So today, it's all about how stress affects your hormones. So I'm going to go ahead and get started. I'm going to share my screen here so you can see what is going on. And then we're going to get started for today. So let me go ahead and get this presenting, and we will go from here. As soon as it loads, I'm just waiting for the computer to catch up with me. You know how that goes. Okay. So, like I said, today is all about how stress affects your hormones. So if you don't know who I am, I'm Dr. Andrea Shanowski. I'm a chiropractor as well as a holistic healthcare provider here in Central Illinois. And really, when we think about it, when we look at stress, I always like to ask people, when you think about stress, what do you think of? Do you think of yourself literally cringing and thinking, oh my gosh, I'm so overwhelmed, I can't do it? Or do you think about the little things that can add up to a stressful environment? So when we think about stress compared to our grandparents' lives, so way back when our grandparents were alive, they dealt with stress from just dealing with family issues and finances and getting food on the table and things like that. But the actual fact is we are so connected, and there's so many more demands in our bodies now to keep up with, number one, what's happening in our environment, but we have a lot more bills. We have a lot more things that we are trying to pay for. Yes, sometimes you do have two breadwinners in the family that are helping to pay those bills, but in a lot of cases right now, especially with COVID and especially with some of our job market issues, we may not be making enough. We may only have one family member that's able to work because the other is staying home with the kids, because let's face it, childcare has really gone up in price. So we want to make sure we're doing the best for our families, but with that comes a lot of stress. So we actually have about 100 times more stress than our grandparents, because like I said, we are dealing with, number one, everything from financial stress to job stress to making ends meet to making sure our kids are taken care of. And if you are like me, sometimes the e-learning that we had to do in the past couple of years, or if you were homeschooling, has been very stressful. So you may be dealing with stress from every single angle. Now, like I said, a lot of those little stressors can add up. So if we think about where stress can come from, if you are not eating regular meals, if you're skipping meals, that can cause blood sugar imbalances or the blood sugar roller coaster that can cause stress in your body. So if you're not eating regular meals, if you're not eating enough food throughout the day and enough calories, your body starts to digest itself. So that does cause a stressful environment. So sometimes it's not just stress. It may be more of some of our lifestyle and dietary habits, as well as the foods that we're eating can cause stress. If you're eating a lot of sugary foods, if you're skipping meals, that can cause, again, that blood sugar roller coaster. We can also have stress from financial difficulty. So if you are, really struggling to make ends meet with bills and taking care of food, especially with gas prices and everything else that have been going up, you may have to kind of make some hard decisions when it comes to the type of food that you're eating, or the amount of food you're providing, or what you can actually purchase at the store, what you can afford. And that can cause a lot of stress as well. And then, of course, we also have worry. So thinking about these things and the gas prices and inflation and everything else that's going on, we may have a lot of thoughts and worries crossing our heads. We may have previous trauma. May have other issues going on emotionally, mentally, physically in our bodies, whether that's health issues or other problems that could be causing a lot of worry for us. And that chronic worry can also cause stress. And then of course you have just plain stress. So getting yelled at, when you're at work trying to manage a bunch of different projects and getting things done and meeting deadlines, or if you're in school, same thing, you may have deadlines that you're up against. All of those little things can cause stress, and that can add up over time to cause a lot of big issues for you as well. So one of the things I always like to kind of talk about when it comes to stress is the adrenal gland. So if you haven't heard of the adrenal gland, it is a tiny gland that sits on top of your kidneys. And that's really what I like to call your stress response gland. And if you've heard anything from me before, you know I like to call it the king or the queen gland, because it literally is the king or the queen that has to function for your body to get through the day. So that is basically where that fight or flight response comes from, is that gland. Anytime you have stress on the body, that gland has to kick into gear and deal with it. So when it comes to the adrenal gland, like I said, I do like to talk a little bit more about the crown. So if you were a female, I call it your queen gland. If you're male, I call it your king. So that adrenal gland for you is going to run the show. What happens is when your body gets stressed, whether it's any of those stressors at all, whether it's doing a workout and working out too heavy, or having a blood sugar imbalance, or skipping a meal, whatever it may be, that stress is going to cause that adrenal gland to have to deal with it. And that means that that gland has to kick into gear, gobble up resources, take that energy and say, okay, I got this. I'm going to deal with this situation, whatever it may be. So if your blood sugar drops, your body actually has to get blood sugar from somewhere to deal with that issue. If you are running out of resources and you haven't been eating regularly, and your body doesn't have resources floating around in the bloodstream, your body may actually have to break down current hormones or even break down muscles to make sure it has resources to deal with this stress. So what can happen is that gland can actually shut down other body systems. So a lot of times what we'll see is in order for that gland to make cortisol to deal with the stressful situation, which is one of the main hormones that it produces, normally that cortisol should be nice and high in the morning, helping you get up. So if you're dragging in the morning, chances are your gland may not be working effectively or may be having some issues overall. But what we'll see is typically, first thing that tends to happen is your gland will start stealing away some resources that your body uses to make energy. So we can see fatigue happen a little bit more often. We may notice that our body is dragging a little bit more throughout the day. We may have a certain time of day where it feels like we completely just drop and are almost falling asleep sitting up. And that may be in the middle of the afternoon. That may be at 5, 6 o'clock. For those of you that are having a hard time staying up past your kids, this may be a sign your body's telling you, hey, I'm running out of energy resources because you're stressed. So you got to do something about it. The other thing that can happen is that gland can also steal away some hormone resources and sex hormone precursors that deal with our mood and libido. So if you're noticing that perhaps you are a little bit more irritable, or perhaps you've lost some interest in some things you previously used to enjoy, or maybe are just not feeling like yourself, what can happen is your body can steal away some of those precursors that help make your sex hormones and help make your mood hormones. So that can cause everything from depression and anxiety. We maybe see irritability or even anger happen from this, or again, we can see libido effects from that too. So if you're having trouble having interest, or if you're having trouble reaching that satisfactory portion of that activity, that may be why, is that your hormones are actually off and not allowing you to experience that properly. We can also see some of our hormones for metabolism be affected. So what typically will happen is if your body is under chronic stress, what's going to happen is your body may actually lower your metabolism. So it's going to be easier for you to gain weight. You may notice that you're putting on pounds or storing a lot of fat, and you're really not being very effective at losing weight, even if nothing changed. You're eating the same foods, you're exercising the same way, maybe you're exercising harder, and it's still really, really, really tough for you to get anywhere with that. That may be due to the fact that your body actually changed metabolism and stole some of those hormone precursors away to deal with stressful situations. We can also see our blood pressure affected. So typically some of those precursors of our hormones that are stolen away for the adrenal gland actually feed into aldosterone, which helps stabilize our blood pressure. So if you're having issues where your blood pressure is very high or very low, or you're noticing after you sit up, either from sitting or lying down, that you're getting kind of a little lightheaded or seeing spots, that may be a sign that your body is having trouble regulating your blood pressure. And that may be directly due to that adrenal gland stealing away some of those hormone precursors that your body needs to manage your blood pressure. Another thing is our thyroid function. A lot of people don't realize this, but when we typically have thyroid issues, you may actually have not necessarily a thyroid problem, A lot of times, with thyroid issues, I do see problems where we have some nutritional deficiencies that can cause thyroid issues. In some cases, we may have some stress on the thyroid gland where it's not able to produce things as it's supposed to be. And what can happen is some of those thyroid hormones go on the bench, or I call it the warm-up bench. But basically, you have active thyroid hormones and you have bench hormones. So the hormones that are waiting to jump out there and jump in when they're needed. But if you're under chronic stress, typically we'll see more on the bench and less out there doing their job. So if we have thyroid issues, sometimes that may be due to stress on the body. What tends to happen is your thyroid gland production actually tends to get decreased and benched because of that stressful environment over time. So a lot of different things that can be affected from that. Sleep is another hormone that can be affected. So some of the precursors that actually feed into your melatonin pathway, which helps you actually get to sleep and stay asleep throughout the night, also be stolen and impacted. So if you're noticing that you are having trouble getting to sleep at night, or if you're noticing that you're waking up multiple times in the night, that may be due to cortisol issues, or maybe even due to melatonin deficiency. So a lot of different things that stress affects in your body. We're going to talk a little bit more about specific hormones that I feel like are really important to understand, some of the biggest things and biggest concerns that I see in my office. So depression, anxiety is one that I mentioned already with that mood and libido. But again, those precursor hormones that help with our hormones and our neurotransmitters that help with anxiety and depression, a lot of times can be thrown off by this same exact pathway. So very important to realize that stress affects your bodies in many different ways and many different systems. And for some people, you may only have one or two of these. For others of you, you may have almost every single one that I mentioned already, having kind of a rearing its ugly head in your body. So one of the biggest things is when we look at some of those stress hormones and some of the precursors, one of the biggest three of the biggest hormones that I find that are most kind of our biggest complaints that I see are the hormones and neurotransmitters that assist with depression and anxiety, the hormones and precursors that deal with insulin balance that can lead to weight gain, and then also the hormones that lead to digestive issues. So we're going to talk a little bit more about these. So number one, when we have stress, we can have depression and anxiety symptoms. We can have weight gain as well as digestive issues. So we're going to talk about each of these. Now there's three main hormones. You notice those are nice and color coded. We're going to talk about those one at a time. So our first hormone we're going to talk about is cortisol. That's the one that leads to depression and anxiety because, again, it interferes with some of those precursors that help with neurotransmitter balance. We're going to talk a little bit more about insulin and how that deals with your weight gain. And we're going to talk a little bit more about serotonin that actually feeds into not only depression and anxiety, but most of the time digestive issues. We're going to talk about all three of these hormones today and what they do and what we can kind of talk about more or what we can help with in our office. So let's start with cortisol. So when you're stressed, your body releases cortisol. So like I said, you may be thinking of yourself like, oh my gosh, I'm overwhelmed. I can't deal with this. That's cortisol. So cortisol is a hormone that your body will release to deal with stressful situations. And when that hormone is released, a lot of people think of that lovely commercial talking about belly fat. It's so much more than that. So cortisol really kicks your body into gear to deal with stressful situations. So one of the things that we'll see is your body can actually break down muscle to turn into sugar. So when your blood sugar drops or your body is needing some blood sugar to deal with stress, your body will say, you know what, I don't have enough sugar in the body. We're going to go ahead and break down your muscles, which is going to lower your metabolism to turn that into sugar. Also, we will see some issues where that cortisol will lower or depress your thyroid function. So we can see thyroid issues come about from this. And then, of course, we can also see when that blood sugar drops and we're needing more sugar, your body is going to crave sugar. So if you're always looking for sugary things like sodas, sweet things, candy, stuff like that, if you're craving those things, those are great signals that your body and your adrenal gland needs more resources so that it can make more cortisol. When we see cortisol high, we can see some issues because cortisol typically, when you do have your cortisol level increase, so every time you get stressed, cortisol kicks out to deal with that situation. About 4 hours later, some of that's still left over, about half of it. So that means that literally every single time you get stressed, 4 hours later, you still got some stress in your body. 8 hours later, you still got your stress in your body. So it can literally be 16 hours before that cortisol disappears. So every single time you cause stress on your body and that adrenal gland has to kick into gear, it affects most of your day. So very important to understand that these hormones have a huge effect on your body and for hours, not just, oh, I'm stressed and I'm over it. It's hours of time before those hormones go back down to normal. The other one we're going to talk about is insulin. So when there's a lot of sugar in your body, that little girl is super cute, but let me tell you, she looks like she's about ready to have a sugar high. So when you think about that blood sugar in your body releases a hormone called insulin. And insulin has to jump in and deal with the sugar high. So what it does is it will actually tell your body to take blood sugar and put it in storage. So we will see that sugar will actually go into our muscles, and if there's leftovers, the rest of it will go to the liver to be packaged up and put in storage for fat for later use. Typically, your body and your liver especially has a huge impact on this. So if we have a lot of blood sugar imbalances, if we're not eating regular meals, if we're not eating a balanced diet and eating a lot of sugary foods, your liver is going to have to work overtime. And I've seen a lot of damage from people that are under chronic stress and people that are dealing with health issues. We may actually start to see some issues where their blood sugar becomes imbalanced due to the fact that their insulin level is going crazy. It's having to respond every single time they eat. And over time, you can also have a condition called insulin sensitivity, where your body now has to make more and release way more insulin to deal with that issue. So your body starts ignoring insulin, saying, you know what, you always overreact, we're just going to ignore you. And that can cause even more stress, because guess what? When your insulin level has to be 4 times higher than normal to deal with a situation of just, you ate a candy bar today, that can cause a lot of stress in other organ systems. And again, your liver is probably the most stressed organ after the adrenal gland when it comes to some of these issues that we're seeing, because your liver has to make things and package them and store them and clean them and get rid of them. So liver gets a lot of demands on it. And then typically, again, with insulin, we will also see that thyroid function gets depressed again. So when your blood sugar is imbalanced, your thyroid function decreases, and that can cause a lot of health issues for you. And then also with insulin, that will increase your blood pressure. So that means that, again, that blood pressure imbalance can be impacted not just by cortisol, but by insulin. So every time you're eating a sugary meal and your body has to deal with that, your blood pressure is going to increase, your thyroid function is going to decrease, your adrenal gland is going to kick in to help deal with that situation. And then your liver has to try to do all the work and play catch up with everything. The other thing to think about too is when insulin is high, that's also going to increase estrogen. And when we have high estrogen levels, that is going to increase your risk factors for every single type of cancer out there. It's going to lead to a hormone imbalance that can also cause issues with moodiness and kind of fits of crying that don't really seem reasonable. I've also seen some issues where when estrogen goes high and progesterone does not enough to counteract that, we can also see joint instabilities. That means that around our cycles or during those situations when those hormones kind of go out of control, we notice that we have joint pain. We notice that all of a sudden, hey, you know, I feel like I'm really hypermobile. Things are just not stable in my spine. And that can affect your chiropractic care. That can affect your workouts. That can affect if you're playing sports. You're going to be more likely to injure yourself as a result of that. So very important to realize that insulin has a huge effect on a lot of different systems. So really important to realize that those high insulin levels can also lead to issues with diabetes. We can see even obesity issues, again, because your body's going to start storing fat. We can see infertility issues because when insulin is high, that definitely interferes with your hormone balance, which can make it hard to not only have ovulation, but also have PCOS symptoms can be a result of insulin resistance and some of these imbalances. And then, of course, with that high estrogen, increase of every type of cancer, but especially breast cancer. So very important to realize that that second hormone, insulin, has a lot of different effects that we don't always realize. And then when your stomach is full, so every time you eat and your body gets that full signal in your stomach, your body says, hey, serotonin's out there, you're good, go ahead and stop eating, we're taken care of. The issue is when your adrenal gland is kicking in and stealing resources, we may not have that serotonin being produced. So that means that your stomach signaling, telling you, hey, I'm hungry, feed me, or hey, you're good, stop eating, may not be working properly. And what can happen is normally when that serotonin is released, that's going to tell you, hey, guess what? We're not hungry. You can stop eating. Don't keep eating. You're going to stretch the stomach and we're going to cause issues and everything else. But if that hormone's not working properly, you may not get that signal, number one, that you're hungry. So if you're not hungry and you're like, well, I'm never hungry, so I just don't eat, that may mean that that hormone has been depressed and decreased and you're not getting those signals properly. We can also see some issues where with that serotonin, about 95% of the serotonin in your body is actually used inside of your gut, so your stomach, your intestines. So if we have had some issues where serotonin levels are not where they need to be due to that lovely adrenal gland stealing away some of those resources, we may actually have digestive issues. We may have heartburn. We may have bloating. We may have issues where our gut is not moving things through the intestine properly or moving things through very quickly and hyperactive. We can actually see some issues where your body can start reacting to some of the foods that you eat, and we can have some issues with IBS or diarrhea coming from that too. So really important to realize that that makes a lot of different systems, again, affected. Serotonin is also what we like to call the happy hormone. That makes you feel good, tells you, okay, you're hungry, you're not hungry anymore, everything's moving properly, you're absorbing plenty of nutrition from your food. But if we have that serotonin level being stolen away by that adrenal gland, we can see a lot of other issues. So I already mentioned previously that we can have some of the issue with anxiety and depression. We can see mood disorders going on as well. We can also see insomnia because serotonin is in the same pathway as melatonin, your sleeping hormone. So we can see where we're having trouble getting to sleep or staying asleep. We can also see serotonin because we do have that happy hormone being depressed. We may notice that we do have some chronic pain as a result of that too, because our body is not able to feel some of that good feeling that helps with the healing response and stimulating other body systems. And like I mentioned, because we have 95% of that used in the gut, we can also have some digestive issues. We can have food allergies and sensitivities. And then one big thing that I have found as well in some of the research, serotonin levels that are low can also be associated with migraines. So I treat a lot of patients with headaches and migraines in my office. Some of those may be due to blood sugar imbalances. Some are due to nerve or blood flow issues where we're not getting proper nerve function or blood flow to the brain. I've also seen hormones have an impact on that, specifically more of our cyclical hormones with menstrual cycle. But again, serotonin levels that are low are going to impact your sleep. They're going to impact your mood. They're going to impact your digestive system. And I have seen that associated with migraines too. So a lot of different things to think about. So to recap, what I always like to do is kind of break it down for you. So if you think that some of these things might be a problem for you, I'm going to go through 7 simple questions to see if you might identify with any of these things that can indicate an issue. So let's go through them. So quiz time. Number 1, are you feeling overwhelmed by tasks that were once a breeze? So if you feel like, you know what, I used to be able to deal with this situation, no problem. Now I feel like I'm overwhelmed and I have no idea how to really focus and concentrate and get through it. I feel like I'm getting very short and I'm snapping at my kids or my coworkers or my husband. And, I'm not really feeling like myself. I'm feeling very irritable and angry all the time. That may be a symptom of your body telling you something's not working right. Number 2, do you get angry over things that never used to bother you? So again, if you have that short fuse, if you tend to be irritated and angry easily, even if you're in traffic or dealing with people in your life that are tending to make you a lot angry, more so than normal, that may be a symptom that your hormones are off balance. Like I mentioned previously, when we have some of those imbalances, we can also see some issues with weight gain. So if you're noticing you haven't really changed anything in your diet and you are gaining weight, or if you're having trouble where you can't gain weight, that can also be some issues where, again, your body is using resources that you need to either help you lose weight and balance that metabolism, or you may just not be able to actually build up muscle mass if you're trying to build muscle. That may be a symptom that your body's using those resources. If it's difficult for you to concentrate, so again, focus and motivation and concentration are all affected by those two. So if you're noticing that you just do not have the brain power to focus on something and stay on task, that may be another symptom that the hormones are working against you. If you feel like you've got no energy or you have crashes in the middle or late in the day, or if you notice you have a second wind, all of a sudden you wake up and all of a sudden you can get stuff done in the afternoon, that may be a symptom that your body is having trouble dealing with and managing those energy resources that help with overall function of your body. And then if you're getting sick more often, so the other thing that's impacted is your healing response. So your immune system can actually be depressed when that adrenal gland is gobbling up resources. So if you're noticing you're getting sick more often, or if you are noticing that it's taking longer to heal. So if you have a scar that normally would take a day or two to kind of close up, you're noticing it's taking a lot longer for that to heal. Or if you've had joint injuries that are taking a lot longer to heal, or lingering longer, like soreness, like you go to work out at the gym, normally you get better in about 2 days, it's taking a lot longer, your body may not be healing as quickly because of that hormone imbalance. So just another thing to think of. So one of the things that I always like to do is kind of tell you, if any of these sound like you, or you feel like, you know what, I might have an issue going on, I'm not sure really what to do, the best thing I would recommend is come sit down and talk with me. Next week, we're going to talk a little bit more about hormones versus health. So we're going to talk a little bit more about, number 1, if you think you're suffering, how can you really know? What can you do about it? Do you need medications or supplements? And the biggest thing is, how do I get better? How can my body heal this condition
So I'm not stuck on medication. I'm not dealing with this for the rest of my life or not getting more complications that lead to other health issues. But like I said, if you think you might have an issue, I would definitely recommend coming to talk to me. So if you don't know about our office is Freedom Chiropractic and Holistic Health. We are located inside of the Metro Center in Peoria, Illinois. We're at the corner of Glen and University. I would be more than happy to sit down with you, do a little meet and greet in my office, talk a little bit more about what's going on for your health, and doing a health consultation with you. Because really, when it comes down to it, it's about ready. It's time for you to really start living your life instead of just surviving it and getting through to the next day. So do meet with me, Dr. Andrea Shanowski here at Freedom Chiropractic Holistic Health. You can either give us a call, 309-689-6200, or go on our website, freedompeoria.org, to request an appointment. And we'll be more than happy to talk with you a little bit more about what we can do in our office. So thank you for joining me for Wellness Wednesday. We went live at 5, and you can watch this anytime after that. Just come back to our YouTube channel to watch this. And we'll be live next week, again, talking about hormones versus health, what you can do about these situations. So tune in next week, again, live at 5 on Wednesdays. So thanks again for joining me, and hopefully you guys had a great day and learned a ton of information that will be helpful for you. So have a great day. And remember, in freedom, in health, there is freedom. So make sure that you get some health or learn something about what you can do to get more health and healthier this year. And we'll talk to you next week, live at 5 on Wellness Wednesday.